All right, Ms. Kemp.
Okay. You ready to start now?
Absolutely.
Okay. Good afternoon, and thank you for joining us. We would like to welcome you to our social emotional learning webinar presented today by myself, Shalene Kemp, and my colleague, Horace E. Stone, Jr.
Hello.
There we go. A little bit about your presenters today. Again, my name is Shalene Kemp. I am a clinical social worker licensed in the states of Ohio and Michigan. I have over 15 years experience with various populations in social work, including at-risk youth, individuals who suffer from substance abuse and mental illness, adults and children affected by trauma, elderly adults, and homeless women with children. Now I will turn it over to my illustrious colleague, Mr. Horace Stone.
You too kind, Ms. Kemp. Thank you. Hello, my name is Horace Stone. I'm a native Detroiter, former elementary teacher, and current school administrator. I've been committed to education for the past 20 years, working with underserved and underrepresented youth, along with educating teachers and adult learners for them to get a better understanding of at-risk youth in urban and suburban communities.
Zoom etiquette. Due to the fact that we are recording this training today, we would like for you to adhere to our Zoom etiquette. Please keep yourself muted. Please make all comments in the group chat. And if you have to eat, speak to another person, or move in the room, please turn off the video.
Our overview. Well, the purpose for why we're doing this webinar is to revisit and bring awareness to the COVID-19 crisis from a social work and academic lens. We will discuss the impact of the COVID-19 in the homes of many and the detrimental impacts on education, how we are able to make a difference in moving forward handling this very serious issue.
Our content objectives. I can identify and discuss 5 examples of familial discord caused by the consequences of the COVID-19 pandemic.
I can create a new understanding of the trauma in the home by the new roles parents have assumed in their children's education during the COVID-19 crisis.
So now we would just like to take a couple minutes for you to reflect a little bit to see what are some of your concerns during this crisis period. If you could take a few moments to post your comments in the chat, it would be greatly appreciated.
We have a question or we have a comment.
Yes.
For students with special needs.
Mm-hmm.
So some of the services for students with special needs, a lot of our providers are working remotely. They are doing a lot of Zoom meetings. They're also tying into the teachers and also administration in being able to assist the students. Also, if if there are people that are, I know we're homebound during this period. Sometimes, in certain cases, we'll have our providers to do wellness checks in which they will go to the home and at least uh, maybe 2 times a week, 1 to 2 times a week, just to make sure that people on their caseload are being sustained and everything, their needs are being met.
Mhm. Thank you.
Thank you. Taking on too many roles. Well, we are mothers, we are fathers, we are sons, we are daughters. Uh, we have lives, we have careers. We're trying to juggle all these things. We're also being pushed into a computer era. At the same time, we're trying to balance a budget and trying to figure out how we're going to maintain our bills. And we're held captive by time. In dealing with all these roles, at the end of the day, we're just saying help, especially during these critical times. And we're trying to move in a direction where we'll be able to maintain ourselves and maintain our focus.
Yes. 5 examples of social discord within the families. Limited resources. According to the Bureau of Labor Statistics, only a third of the workforce in the country, excuse me, is able to work from home. Event cancellations and postponements that have employed hourly workers are now leaving them with one less paycheck in the household. Some of the other causes for concern with limited resources are job loss or underemployment. Families are experiencing strained finances. Families are disconnected from their social support systems due to social distancing limits. And then there are grocery store shortages, which is also a component of this that's causing a lot of our families stress. There are shortages such as lack of disinfectant supplies, meat, and toilet paper, different things like that, which is leading to increased stress in our families. Increased stress. Children and adults are experiencing an increase in stress at this time. Both children and adults are experiencing stress regarding the uncertainty about this crisis. Children also are experiencing an increased stress because they are learning from parents, especially parents who have short fuses and long explanations. That can be problematic for a child. Getting used to different schedules. Children are oftentimes staying up late, having limited outside activities, and spending less time with their friends due to the limits on social distancing. A lot of children are experiencing poor diets, missing meals, and different things like that, or even just eating non-balanced meals. Some of the stressors that parents and adults are facing are difficulty teaching or helping their children with unfamiliar material. In a lot of instances, the parents are just not as familiar with some of the things that the kids are learning in schools these days. Lack of various activities to keep their children engaged. It's very hard for parents to entertain their children a lot of times. So they're struggling with that. And also, parents and adults are struggling because they themselves have limited social outlets. So being in quarantine and having fewer choices, having other people make life choices for you, similar to when you can leave, how long you can be there, where you can go. These things can replicate the trauma that some people have experienced, both in their relationships and as members of oppressed and marginalized groups within our society.
Before you move on to the next slide, I
Mhm.
just comment on this. When we talking about this type of stress and this type of aggravation that's going on, I've heard many people comment in the public that they compare this quarantine as being locked up in a prison or being held almost hostage.
Mm-hmm.
Can you speak to that, Ms. Kim?
I have also heard those comparisons be made as well. And a lot of times, just because people don't have that freedom of choice, they don't feel like they have a freedom of choice anymore. They're being told to wear masks. They're being told how far they can stand to a person in a public place and different things like that. So yes, that can be very limiting, and it can feel like, you might be a hostage or in a jail or, different things like that. That is definitely one of the things that causes an increased stress in people during this time. Increased abuse, increased domestic violence. There were some predictions made prior to, well, once they decided that they were going to lock down the different states, there were some predictions made saying that things like abuse would increase. Because the research hasn't been compiled as of yet, and because we are still in the middle of this crisis, we don't have those exact numbers as of yet. But we do know that frustrated people can be emotionally mean and physically violent. We know that things that people use in their safety plans are no longer available, which leaves individuals trapped in an escalating cycle of tension, power, and control. We also know that there have been an increase in child abuse. Although the reports from the agencies are reporting a decline in new reports due to school cancellations, because schools are the biggest reporters of child abuse. Stressed parents are more likely to respond to their children's anxious behaviors or demands in aggressive or abusive ways. And a lot of times, the resources that many at-risk parents rely on, such as extended family, child care, schools, religious groups, and other community organizations, are no longer available in many areas. Also, many child protective agencies are experiencing a strain with fewer workers being available. So they may be unable to conduct home visits in areas with stay-at-home orders. Also, during March of 2020, there was an onset of new distance learning methods driven by the COVID-19 crisis. The National Center for Missing and Exploited Children received 2,027,520 reports of online sexual exploitation, which is a 106% increase over March of 2019. The online sexual exploitation of children is a massive problem. The dramatic increase in the time that our children spend online creates a target-rich environment for child predators who use various online methods to sexually exploit our children. Also, there have been reports of increased substance abuse during this time. Isolation and anxiety prompted by the pandemic may result in relapses, accidental overdoses, or problematic substance use, even by people who have never had issues with substance abuse prior to this. Grief. I want to start by saying that grief is a normal reaction to any form of loss. However, grief during this pandemic has become epic due to the several simultaneous losses that people have experienced during this time and during a brief period of time. So it could be a loss of a job, loss of a loved one, just multiple things all happening at once. Also to be noted is that families have been unable to grieve together during this time due to the limits of social distancing. So some of the other things that individuals are grieving during this time are their sense of safety. And that's very important to a lot of people. In order for you to feel healthy, is to feel safe. Social connections. People are grieving the loss of or the inability to engage in their social connections. Financial security is another thing due to job losses, as mentioned earlier. Personal freedoms. Again, people are grieving the loss of their freedom to go wherever they want to go, whenever they want to go, and be as close to people as they can be due to the limits being placed upon them by social distancing. Also, people are grieving the loss of anything that feels like a loss of identity. So a lot of people identify with being a teacher or being a principal or being a hospital worker or whatever. But due to the limits of social distancing, due to the fact that a lot of people are unemployed during this time, they are not necessarily identifying with having those jobs because those jobs, they're not working them right now. So people are struggling with those losses as well. And also death. Last but not least, death. Excuse me. A lot of people have lost loved ones connected to this virus, and people are grieving in various ways.
Can I interject? I just wanted to ask you about anything that feels like a loss of identity. And you talked about, people in different careers and in different fields, not being able to identify, with, I believe, themselves due to the fact that they're not operating in their field. So are they having a sense of loss of purpose? Could you talk a little bit more about that?
For a lot of people, it can be a loss of purpose, especially people who identify with what their profession is. So if a person, you ask a person when you first meet them, hey, how are you? Tell me a little bit about yourself. And people say, oh, I'm the principal at a school. It's fair to say that that position that they have is very important to them. So that's connected in a lot of instances to their identity and who they see themselves as. So if you have a situation where maybe your job is shut down, and you're not able to complete those duties at this time, it can feel like a loss to a lot of people. Right. Whether it's an actual loss or a perceived loss, that's something different, but people can internalize that in different ways.
Okay.
The last one is an increased risk of suicide. So isolation, along with excessive anxiety and other emotions that people are dealing with, can greatly decrease mental wellness, therefore increasing the chances of suicidal thoughts and behaviors. People are feeling disconnected from their social supports, which leads to increased loneliness. Again, safety plan resources are no longer available in some areas. We know that people have been discouraged from presenting at overwhelmed emergency rooms due to the COVID-19 crisis. So a lot of people's safety plan might involve going to the emergency room if they're feeling suicidal, and people are kind of scared to do that. Also to be noted is that in April 2020, Knox County, Tennessee, their crisis line experienced a 62% increase in conversations compared to April of 2019. Also to be noted is during that time frame in late February, beginning of March, 9 people committed suicide in a 48-hour period. According to the Knox County officials, most of the suicide cases in Knox County were related to a relationship or domestic partnership, but they can also be attributed to the effects of the outbreak. It is also believed that job loss and self-quarantining, on top of that particular region recovering from some tornadoes that hit in March and killed more than 20 people, that could have also played a part in the increased risk in suicide. Nationwide, people have, like I said earlier, been discouraged from presenting at overwhelmed emergency rooms for fear of spreading the virus. And it's also important to note that many people who die by suicide have a mental or emotional disorder. The most common underlying disorder is depression, but 30 to 70% of suicide victims suffer from major depressive disorder or bipolar, also known as manic depressive disorder. And also important, I put down here for anyone who may need assistance, The National Suicide Hotline number is 1-800-273-TALK or 1-800-273-8255.
So, Ms. Kemp,
Yes.
before we move a little further, we're talking about suicide. Uh, have you gotten word that is it a larger spike in suicides amongst our youth, or are you noticing the trend going up pertaining to adults?
Well, the final numbers, of course, are not in yet because we're still in the midst of the pandemic. And I know
Yes.
when I was doing my research, I saw that this particular area had kind of 9 suicides in 48 hours is a lot for anybody. So I think that's
Yes.
the reason that made it to the top of the news sources. Um, in all actuality, we really don't know as of yet. We just know that people are experiencing different things and people are struggling to deal with these things that they're feeling because they don't have their normal outlets. So thank goodness that, a lot of doctors and therapists are doing online therapy. They're doing telehealth visits to help people kind of cope with their feelings surrounding this pandemic.
Yes. Thank you.
So right now, we just wanted to take a couple minutes. If you have any questions or comments, please feel free to type them in the chat.
We have a question already
Yes.
where it says, as a teacher, how do you think school will be affected?
Mm.
And that's a great question. We're going to touch on more of that, but I think one of the ways that school will be affected is by us moving to a cyber platform. We will have to have more training. We will have to be more intentional in our process of being able to communicate the necessary information in the curriculum to our students. And we're going to have to be more strategic in uh, delivering our curriculum. So these are some of the things that are going to take place, and we're just looking for greater outcomes.
Absolutely.
So we'll give you a couple more minutes. If you have some more questions pertaining to Mrs. Kemp's part of the presentation, feel free to put them in the chat now. Thank you. Impact of school closures. This is a very hot topic. We're beginning in education to really dive into this topic, trying to figure out what are next steps. We were already moving toward a technological way of doing things, beginning to see more computers and more technology being integrated into school and into the curriculum and into the teacher's delivery. But what the pandemic has done is just thrust us into a whole nother realm of thinking. If you take a look at the screen, you'll see the tale of two tapes. On the left is a school building. It appears to be very viable. It appears to be in great state and waiting for children to come in. If we look at the classroom to the right, we see that there is, it appears to be unkept, desolate, and no forms of life. And the reason why we have these two pictures is a basic depiction of how things are presently to the left and how things could be to the right in the future if we go to a technology immersed curriculum where people will be working from home instead of coming into the brick and mortar buildings that we are currently working and servicing our young scholars in now. Well, there are three major questions impacting schools and school districts. And I only want to take a minute of your time for each one of these questions. How will public education retain their students? Take a moment to answer that question, please. I see a question already in the
Yes,
chat. Do you believe the lack of safe places due to closures has affected the suicide and domestic violence rates? That goes to
absolutely.
you.
Absolutely. I believe that. Um, because people are not feeling safe. A lot of the shelters are, I know here in Ohio, a lot of the shelters are not necessarily closed, but they're controlling the number of people that they allow to come and go. Excuse me. So it's very difficult to move around within the system and within the confines of a shelter type environment. So due to that and due to the limitations, a lot of people are staying in situations longer than maybe they would have stayed had they had another opportunity. So I do believe that the stress of that bothers people, and it does impact their mental wellness, and it can affect them to the point where their mental wellness declines and they could be contemplating suicide.
Going
Absolutely.
Going to the next question, says, do students have the necessary supplies to work from home? Just take a minute to answer that question. I see a communication in the chat now. It says, do you believe the lack of safe place due to school? Oh, it says, what do you mean by public schools? Do you not believe it's affecting all schools, all students? Well, um, so it is affecting all schools, and it is affecting all students, and not just public schools. I took on the communication of public schools um, because I operate in public schools, but charter schools are affected, parochial schools are affected, all forms of education are affected, and it's basically how will we look at this or take a look at this issue from a different lens. So it's not just pertaining to public schools. Great question.
Mhm.
Last question. What are the effects of moving to a cyber platform in most communities? Uh,
Look like something happened in the chat.
yeah, I see where it says retention is based on families having a choice. There are no choices right now. Access and equity. And those are both great comments. I'm gonna start backwards. When we deal with access and equity, uh, that is something that has to be addressed, and it's a very number one issue on on our list in education. When we're talking about the equitable piece, we're talking about students having the necessary supplies, the necessary access to technology, also internet services to be able to participate with the curriculums at hand. And this is a very important aspect that we're looking at right now in education. And then with retention, parents are going to have to, uh, it is a selection process right now where parents do have the right, because the governor has stated, well, you can go ahead and promote your students. We're not looking at failing the children due to the COVID-19 uh, crisis. However, parents do have the right to say that they want to retain their children. Just a thought, if you never heal from what hurt you, then you will bleed on people that did not cut you. And so when we talk about this, we're basically saying if we don't address the issues of our young scholars, then they will continue to have shortages as far as the understanding and their learning due to their basic needs not being addressed. And a lot of times students come in with their basic needs not being addressed. And it is an issue. And then we're looking and we're asking, well, why isn't the children processing or moving at a swifter pace with academics? Well, because we haven't taken care of the finite issues, which are they well clothed? Are they able to eat? Do they have a stable place to stay? So these are some of the issues that we are definitely looking at addressing. Stress of the classroom management at home. There was an article in the Insider, May 8th, 2020. This comment was made, mental health warning signs to look out for in your children during the coronavirus pandemic, according to experts. You may find children have a very short attention span for things which may normally have been mitigated or by their schooling environment that offers more stimulation. One of which is just students, our young scholars, being able to pay attention. If they were in the school setting and they were working with their fellow students, it's tailor-made for them to maybe have more focus in that environment than at home where there are a lot of distractions and people working on top of each other and familiar surroundings where their attention span can be shortened or they can lose the focus that they're supposed to have on their lesson to do other things. Boredom can be a symptom of depression. We know that our young scholars are not able to uh, communicate and say how they feel, especially in the elementary stage. And sometimes not having interaction with other students and other children can cause depression and frustration along with aggravation. Antisocial behavior could be another sign of a larger issue. Well, when you're working one-on-one in a computer setting, it causes our young scholars to be recluse and to be into themselves. Last, look out for changes in eating patterns. Well, that could be a telltale sign that ties into both of the previous issues of antisocial and depression states.
I also wanted to add that psychosomatic complaints, so headaches, children complaining of headaches and stomach aches, those can also be symptoms of depression, and also irritability in children can also be symptoms and signs of depression.
Thank you. Etiquette of cyber learning. Cyber learning etiquette is a hot topic now that we are being thrusted into the cyber age due to the pandemic. Here are some examples. If you would not say a comment in a person, please do not say it online. Due to the large number of people using technological resource from your school building, do not overload the system with huge files. And third, send information people can depend on being accurate. Well, take a couple minutes, and no more than about 2 minutes or so. And could you put in the chat some more cyber etiquettes that you feel our young scholars, as well as our parents, should have during this time of the COVID-19 crisis? Challenges of educational cyber platform. Students at home in many districts are not equipped with computers or internet access. Teachers in many districts are not familiar with teaching in a cyber arena. There is a challenge for teachers to obtain the professional development to learn a new cyber platform. And why that's very interesting is because we have a lot of our educators that have 20 plus years and 30 plus years of experience. And during that time, there has been a great evolution in technology and the delivery of the curriculum via the cyber platform, which has caused challenges even for our educators to be able to work in reversing classrooms uh, and being able to uh, send out assignments via different apps where students are able to communicate. Last, we have parents are not receptive to this process due to the COVID-19 and other concerns such as being laid off, grieving, losing a loved one, or lack of education.
I think also to be noted would be the technological issues, just issues with technology. They can have the computers and the internet access, but maybe the internet is a little slowed down because so many people are on the internet and working from home and different things like that. So the technological difficulties could also be a challenge.
Yes. Parental frustration working with academics. This is a universal issue during this period. Parents are finding themselves getting just as stressed out as the children. Well, what are the factors? Let's take factor one, lack of knowledge working with the designated subject area.
I'm not good in math, and you're asking me to find the perimeter?
These are typical comments that are made to the educator, to administration, based upon our parents are very frustrated with trying to teach the subject area or the designated subject area to our young scholars, and they only want the best for their children. Unfortunately, because they don't know uh, the proper delivery techniques, because this is not their field, that's a source of frustration. Factor two, lack of patience working with their students.
I don't know how to teach this information to my kids.
Right. And also, this is a very common comment. And it's very common due to, once again, our parents want the best for their children, oftentimes not knowing how to go about communicating and how to go about saying certain things. And so they find themselves aggravated because what they say and how they go about saying it doesn't come off exactly textbook, so to speak.
Mm-hmm.
We have a comment in the chat.
Yes.
Families with multiple children who all need to be online at the same time.
Yes.
Only one computer or other factors, space, etc.
Absolutely.
Absolutely right. That's huge. You have one computer. All of them have to be on at the same time. The cell phone is not adequate. And when we are in a home and that's only 1,000 square feet, but in that 1,000 square feet, you have two bedrooms, a den, and a living room. And here we're all squeezed in and we're trying to work at the same time. It can compete, it can be very frustrating, frustrating, and it can also be aggravating to our scholars trying to pursue the classwork and demands that the teachers are putting on them.
I think that's also an access question. I'm not sure if anybody's thinking about that, but just bringing it to the forefront, saying, hey, because the one computer at home could be the parents' computer to use for work while they're working at home. And I'm just not sure if anybody's thought about, saying, hey, how many school age kids do you have in the house? And, maybe we can offer some resources to assist with that as well. But that's a whole nother topic for another day. So what is next? Would you like more in-depth information regarding the topics we discussed today? If so, be on the lookout for upcoming training, which will increase your wheelhouse of knowledge.
So in the chat, we have a survey, and we would be so gracious if you would fill out that survey for us. So we will be able to design our next trainings and our next communications, and we can understand how we can better serve you during this COVID-19 crisis, but also moving forward on dealing with our young scholars from a social work perspective and an academic lens. Thank you.
So we would like to take this moment to thank you again for joining us this afternoon. We appreciate your time, you spending some of your time with us. And if you have any questions or comments or anything and would like to contact us, our email addresses are on the screen. Again, my name is Shalane Kemp, and I would like to thank you for coming. Mr. Stone?
I would just like to say we're very humbled and very thankful for all participants coming to our training today. And we hope that we were able to shed some light once again dealing with this COVID-19 crisis from a social work lens and also from an academic lens. We thank you and appreciate you. Have a good day.
Thank you. Anything in the chat?
No, ma'am.
All right. All right.
Nothing in the chat. Mhm. Oh, we got thank you. Thank
Oh, thank you. Got something else in the chat, sir?
you. Nothing else in the chat.
Okay.
Nothing else in the chat.
Okay. Hello, Mr. Fisher.
Hey, how's it going?
Good. How are you?
I am doing well. How about you all?
Good.
I have a question.
Yes.
I'm overwhelmed by being stuck in the house. What can I do to alleviate this feeling?
Exercise is always good. Trying to get out, get around some different environments, go to the park, all of those things would help.
Well, that's problem solved right there. I've done none of those things. I just wrote them all down.
Ah,
Any,
nice.
yeah. Any order? Any one of those suggestions more effective than the other?
Nah, you can do whatever one you would like to try first, try it. You can also journal if you want to do that. Make some arts and crafts to take your frustration out that way. You can do that.
Oh,
A lot of
journaling. I'm
options.
gonna try that. I'll do that with the kids. Journaling.
Yeah. Somebody had a real good suggestion. What was it called? It was like a COVID-19 log or something where people could like write down, sit down with their kids and write down their experiences going through this, you know, age appropriate, of course. And so they can kind of have it to kind of share with maybe their kids or whatever when the time comes later on down the line, or just for their own memories. So I thought that was kind of a cool idea. Yeah. Mm-mm.
So once again, we would just like to say thank you for all the participants that came to us today. We appreciate your time and allowing us to be able to speak and to communicate. And we also have this uh, communication in this webinar. We have it taped already. So we will be distributing this recording out to you all. Thank you so much. Have a great day.
Thank you.